Filbert. This is Diane with the Allegany County Health Department.
We talked on the phone.
Yeah.
Hi, Haley.
Come on in.
So nice to meet you.
Nice to meet you.
Nice to meet you.
Alright. So, Haley, Sam's that magical whiz that's going to test all your paint and that kind of thing. And, well, maybe, do you got a place we can sit down?
Yeah, let's go to the table.
I think it'd be kind of nice for Sam to show the. Okay. So, Haley, it's kind of nice to have two people here. He's the whiz at Latin. I just write this stuff down. Okay, so you're gonna see him do some. Why don't you get out your measuring device?
So what we're going to be using to measuring is called an XRF gun. That stands for X-ray fluorescence. Basically,
And there's no test. You don't have to remember that. Okay.
So what we're going to do is this gun is going to scan for concentrations of lead. It does that by firing out a beam of radiation. When it hits a heavy metal, it's going to bounce back to the gun. It's going to tell me the concentration. How we do this is we're going to go from room to room. We're going to scan various surfaces that your child's interacting with, and we're just going to see if we can determine what is lead-based paint, and then from there, if it's a possible hazard to your child.
And Sam, is it true in your things? Have you found like areas of lead that are higher in some places?
Oh,
lower
absolutely.
In some places. So
like, what is considered a high or a bad lead?
So we're going to go off of the threshold system of 1. In other words, if it's above a 1.0 when the gun reads it, it's considered lead-based paint. If it's below a 1.0, it is not of concern.
Okay, so he's gonna show the numbers. I'm gonna just write them down. Okay. So what area I would say? Well, sleeping rooms are upstairs, right?
Yes.
Okay, so we'll get to that. But which room does he spend?
Like this area,
in that area?
the living room.
Okay.
Yeah.
Okay. So we're gonna go to the most lived-in areas first.
What are you guys doing here?
Hi there.
Hey.
What are you doing in my daughter's
I'm
home?
Diane from Allegany County Health Department, and this is Sam. And have you talked to your mom about this visit today?
Yeah.
Okay.
I have.
Okay. So we're just here doing that lead visit. We're gonna try to see if we find any lead with this little device right here.
You know we've lived here for like 30 years, and we've never
30
had an issue.
years.
So.
Okay. Yeah. So well, I mean, you told her about the blood work. Yeah. So Drew had that blood work. You know, she told you about the lead level was high. I think, what was it, like 40 or something like that? Yeah. So the normal lead level is actually 0. Did you know that? Yeah.
No
So
amount of lead
none.
is
Okay.
natural
Because
in your blood.
yeah. So lead's a toxin. It's a poison, right? So when somebody's lead level comes, whether it's a kid or whether it's an adult, we need to investigate and find out, okay, where's it come from? And let's work together and help Haley get the lead taken care of.
Does that mean you're going to call CPS on us?
Oh, well, I tell you what, I think right from the very start, Haley has been really great about working with us, and I feel like she's going to be great to work with.
Mm-hmm.
CPS, we're here. I know that's a common thing, right?
I know it's scary. It's the assumption of the health department's coming into my house. What are they going to do? How do they handle this? CPS, first, we're environmental. That is a completely different section from us. That's only going to happen in cases where families are completely uncooperative. They're not letting us in, and our main concern for why that would happen is you're not letting us in and your kid's getting poisoned.
Yeah.
I mean, us just being here says you guys want to help your
Yeah.
kid, and that's all we're really here for.
And that's it. Those lead levels, they get reported. They go into the system. And so then they come back to us, and wherever the child lives, right? Then, and it's in Allegany County in this situation, right? Then what we have to do is we are accountable to then follow up and try to make this system where there is no lead in the level. Okay. So and you mentioned you lived here for 30 years,
Yeah,
right?
long time.
Well, I know you're not 30 years old, but the thing is, did you ever have like Haley tested when she was?
Not that I know of, no.
Nothing you know of, yeah. Because you would know. I mean, somebody would, if there was a high level, or a test like that, you would have to have your permission, that kind of thing. So, the testing, it was real big, in the 70s, and then we got rid of that lead paint. When did the lead paint go out?
That was 1978.
1978. And then after that, we kind of figured, oh, there's not a lot of lead going on, but now we're seeing this. I've been a nurse for many, many years, and we're seeing where kids come into the emergency room and they're missing those milestones.
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 That's a fancy word for.
It is a fancy word. Has your pediatrician ever said that, talked about milestones? That's like where at 2 months you're supposed to be doing this. At 4 months you don't, you should roll over. At a certain time period you should be able to sit up on your own, Yeah, so.
Drew's doctor did say he should be sitting up, and he's not.
So that's like, so when that kind of thing happens, right? Then, they have the lead level done. So in Drew's case, he ended up having the lead level done because his doctor noticed he was missing those milestones. And I don't want to keep you from your lead visit, but I do carry these with me, and these are an example of like some things that you could put up on your refrigerator. They're a copy of milestones just for, I think these are only until the age, 6 years. But you could kind of keep them and
He should
use
be
them.
doing this stuff, and he's not doing it.
Yeah, for a guy, that kind of thing. So when we see it, we got to figure it out. Now it always can be something different. It doesn't necessarily have to be because there's lead in here. We're gonna find that out today, right?
Yep.
It also can be when somebody has some lead in the soil outside. Okay. It could be coming in from the soil, or it could be coming in. Somebody could bring it in from an occupation. Maybe they're working with cars and they're removing old lead paint, from cars, and then they got it on their clothes and they bring it into the house, that kind of thing.
It could even be in your drinking water, which of course we'll be testing that as well.
Okay. So I understand how upsetting it could be because of your house. You know what I mean? It's your house. You didn't have any problems that you could think of, but if you're on that ADHD medicine, that is a sign. That is one of the things that can happen when you
He
have
did
some.
have trouble concentrating in school.
Yeah. So it's just something to think about. But you know what I say? Numbers don't lie, right? So let's go find out what those numbers are. Okay, so we can.
We'll get started.
Okay.
Yep.
I'm gonna write some of the numbers down. This is you can go ahead and
All right, will do.
write down. Oh, this is gonna be the law.
All right.
Okay.
First reading.
Yep.
1.5.
Okay.
Condition is good. No deterioration.
Okay.
All right. Do a decorative part of the wall. We'll grab here. .2.
Okay.
Condition is good.
Okay. What about that little cracked area right there?
Let's take a look. .8. Condition is deteriorated.
Deteriorating.
So
Okay.
you said 1. Anything above 1 is bad.
Right.
Okay. This is making me a little nervous.
It is, yeah. Okay. So let's get all the numbers. Okay. Let's get all the numbers, and then maybe we can sit at the table and alleviate some of that stress. Okay. Because we're here. We're gonna show you how to.
We'll discuss with you what this means
Okay.
and how you can take care of it.
Okay. Perfect. So that's the other labs. Window.
3.4. Deteriorated.
Okay. Oh, Haley. Oh, I'm so sorry. All right, you guys. This is not good. This is not as bad as it seems. Okay.
I'm just getting really upset.
Yeah. Here, Sam. Can we sit down at the table?
We'll discuss everything that's
Yeah.
going
Let's-
on. We'll go over what is and isn't an issue. No need to worry, all right? What we're gonna do is we're gonna list out everything for you. We're gonna explain what you can do right now, and I'm gonna write up what's called a notice of demand for you. That's just going to be a list stating what we found.
Like where
and
the
what we
areas are,
recommend
right?
You do.
Yeah.
Okay?
That kind of thing. So can you sit at the table for a minute? I can't have her this upset before we go upstairs. So that's the brief synopsis of what, just like you would live in that house that we just went out.
Okay,
Okay.
sure, absolutely.
All right, Haley, Robin, take a deep breath. Okay, you good? Okay, Sam.
Based on what we found in the playroom, we identified there was some deteriorated lead-based paint just around certain pieces of decorative walling, over by the windowsills and stuff. That's fairly common, all right? So mainly what you're gonna be looking at is the lighter white paint. Now, what you can do right now for that is lead-based paint, the issue you're gonna run into is lead dust. All right. So I would say just make sure you're wiping down all these surfaces. Make sure you mop the floor. And if you're gonna use any wipes, dispose of the wipes, because what we're worried about is small bits of lead dust that your kid might just be picking up when they're touching the floor, touching toys, and they might get that into their mouth, okay?
Does Drew ever eat over in that area right there? Right, like, cause my kids had a bowl of cereal, like a cereal everywhere, right? Or snacks or something, right?
Yeah.
So that's gonna be really super important, you know, that that's wiped down, because we know Drew is gonna drop a piece of food on it, if he's normal, right? Drop a piece of food on the floor, put it in his mouth, we don't want that to happen. And that's, and when you talked about that dust, I haven't had a chance to talk a whole lot with you know, Robin, and, because I just met her today, and then Haley about like lead dust. So lead dust, that's got metal, that's a metal, right? That's the poison right there, right? So that's gets in our body, in case you were wondering, how does this happen? Because honestly, I mean, this place is in good shape. I mean, the paint, it's beautiful. I love the way you've decorated and you've kept it up. But I mean, it's just little things that we don't know about. I got a house 1907, so I totally, that's why I feel like I really can relate to this situation. And when I first heard about all this lead stuff, I went home and, you know, had my house tested too, because I'm like, 1907, you know.
We just didn't have any idea.
No, you
we
just didn't
definitely
have
don't want
any idea.
anything going on with Drew. We want him to grow the way he needs to.
So that's so important, you know, there. And then, you know, we're gonna go up later and get the, you know, the sleeping room. Like you said, everyone's sleeping upstairs. So, like, if they're higher up there, what you're probably gonna recommend they get that room done first. I mean, because what is our highest number here so far? We got that 4.8.
So main rooms you should take care of first when handling lead hazards are rooms the kids interacting more often with. So that would be the area they sleep in most definitely. Playroom. If they're in the kitchen often and you identify there's a problem in the kitchen, you're going to want to take care of the kitchen.
Yeah. Okay. So and then so once so how will she contact? How did you want her to contact you?
Well, here is my card.
Okay.
And keep in mind, if you have any questions, any whatsoever, don't be afraid to call, all right? I'll just be sitting back behind my desk bored half the time anyway.
And so we'll be going upstairs, you know, but before we go upstairs, I just want you guys to have a good feeling about this. You know, we're on that same team that you are. The county, this is the county that wants to help you, okay? We want to help you. We want to help you improve your health and Drew's health and anybody else. Actually, Robin, you babysit here?
Yeah.
Yeah, see, we want her health to be good too. So I'm gonna just say, from a nursing standpoint of view, if Drew has a little bit of lead in his blood, and what did we say, he was 40, right? 40 with his lead level, normal level is 0, chances are, guys, you guys can have some lead in your thing too. So do you know how you can get tested for that?
I don't.
Okay, so what you can do is, just like you went to, you know, the pediatrician, or, you know, for a visit, and Drew couldn't sit up, and so he said, could be lead, and then he probably asked you about your house, like, do you live in an older house? Did he ask you that?
He did.
Yeah, or she? So with that, you know, that's how you got the order to get the lab work, okay? We don't put the orders in, we're not doing the lead testing, you know, but for you guys, just, you guys each have a doctor or a physician assistant or something that you go to?
Yeah.
Go to them, right? Make an appointment. And you want to get, just say, you know what, my son was, you know, tested high for lead. We live in a house that was built before, was it 1978? Is that what you live in?
1978,
Before 1978. And you know, could you put an order in for me to get a blood test? And it's a blood test. They're going to take it, you know, both for you know, right here, just like they did the blood test for Drew. So that's how it goes. So what do you say? Any questions at all?
I think it's definitely important that we get tested, and I'm starting to feel a little bit
You're
better.
starting to feel better.
I
Okay.
agree.
Good. Okay. So if it's okay, can we all go upstairs and get those
Absolutely.
sleeping rooms?
Let's
Is that
go.
okay with you? Great. Thank you.